Good morning, everyone, and thank you for inviting us to present this piece of research here today. I am Helen Young, and together with my colleague, Dr. Roxana-Maria Rujan, we will be presenting work on the Psoriasis Priority Setting Partnership, its influence, impact, and outcomes. Now, as you will be aware, the Psoriasis Priority Setting Partnership was a highly collaborative piece of work championed by the Psoriasis Association, which completed in 2018, having set out to determine the really important questions about psoriasis that needed answering. And in this follow-on project, we asked a straightforward but important question, which incidentally no other priority setting partnerships have asked. And that was, after the Psoriasis Priority Setting Partnership completed and its top priorities were published, did it actually make a difference? So over the next few minutes, Roxana-Maria and I will walk you through a short introduction to priority setting partnerships, talk briefly about the Psoriasis PSP and its original outputs, and then we will move on to the results of this study and what we found out by talking to funding bodies, the research community, and the people who took part in the Psoriasis PSP itself. So a priority setting partnership, or PSP for short, is a process in which patients, carers, and clinicians come together to agree the most important unanswered questions in a disease of interest. The goal is to influence the direction of future research so that it reflects what actually matters to people living with the condition and those who treat them. All PSPs are facilitated by the James Lind Alliance, which provides a structured and transparent methodology to ensure a fair prioritization process. The psoriasis PSP itself was an extensive, collaborative, and multi-step process. In our initial survey, over 2,000 questions were gathered from patients, carers, and health professionals, reflecting the substantial unmet need and uncertainty that exists in psoriasis research and care. These questions were reviewed, refined, and prioritized through a series of steps before being discussed at a final workshop in September 2018, where patients and clinicians jointly agreed the top 10 research priorities, which were formally announced in November 2018 at the 50th birthday celebrations for the Psoriasis Association. Now, these are the original top 10 priorities that came out of that process. I won't read everyone in detail, but I want to draw your attention to what was agreed. And you can see that there are questions spanning lifestyle factors through to early interventions, treatment predictors, symptom management, and psychological interventions. As well, there were questions about comorbidity, impact and risks, treatment failure, genetics, environmental and other factors, and flare management. And I think it's important to note that these priorities demand a greater understanding of the whole picture of living with psoriasis, just as much as the development of new therapies for the condition. So, having set the scene, I'm now going to hand over to Roxana-Maria to tell you about how we measured and assessed the impact of the psoriasis PSP.
Thank you very much, Helen, for the introduction. So we first examined how the grants landscape has changed since the publication of the PSP in November 2018. So alongside searching funders' grant databases, we also spoke with representatives from NIHR, MRC, Wellcome Trust, and British Skin Foundation. Some of what I'll present today will draw on those conversations as additional context. So in total, we gathered 101 grants. Of these, 31 are in progress, 67 are completed, and 3 are due to start. We also look at the top institutions who are leading the psoriasis research based on the number of grants, and the top 5 institutions are the University of Manchester, King's College London, University of Oxford, University of Southampton, and Newcastle University. So to make sense of the grants data, we develop a framework for classifying how closely related funded research aligned to the psoriasis PSP. So we defined 2 levels. Direct alignment covers studies that address or are specifically designed to address a psoriasis PSP priority. Or in the case of psoriatic arthritis studies, there is at least one research question that directly can be mapped to psoriasis PSP priority. Indirect alignment covers broader studies, such as immune-mediated inflammatory diseases research with a psoriasis subgroup, or a study that generates new knowledge that can be used by the psoriasis population. And of course, and can be mapped to the PSP priorities. And also this study, it's in this category. So having this framework was important to ensure that our mapping is consistent and transparent. So all the mapping was done based on the study abstracts. So here we can see the distribution of the grants number mapped to the PSP priorities, and with the group by the category alignment. So we can see the most funding research was given to studies that focus on treatment response predictors, symptom treatments, genetics and other factors, and comorbidities risks. So this slide shows the total amount of funding invested in psoriasis-related research since the PSP was published in November 2018, grouped by the study status. So that's a total of £33.63 million. So breaking this down further, here we can see the number of grants by funder and the type of the award given, such as Career Development Award, Research Award, or Studentship. A few points from my conversation with funders are worth adding here. So for example, from my conversation with NIHR, they do have active calls specifically linked to PSPs. So there is a formal pathway where the psoriasis PSP priorities can influence what gets funded. However, in researcher-led calls, funders cannot give additional weighting to PSP, psoriasis PSP aligned research or any other PSP, because doing so, it would disadvantage applications which are equally strong, but falls outside the PSP remit, or there is no PSP in that research area. So the main broader message from the funders was that raising awareness of the PSP is not their role, but supporting research that fits their remit, including PSP-aligned work, absolutely is. So here we can see the financial scale of the investment, and we can see where the most of the funding originated, with NIHR and MRC contributed the most funds. It is worth noting that much of the period covered by this analysis coincided with the COVID-19 pandemic, during which substantial funds were redirected towards COVID-19 research. So this may have impacted the psoriasis funding. So now we turn to the research community itself. So we asked researchers working in psoriasis to submit studies they think they are relevant, map them against PSP priorities, provide any additional publications, and report any PSP influence. We received 43 studies. Of these, 38 are fully aligned, and 5 are partially aligned with the PSP priorities. So this slide gets to the heart of the question: how exactly researchers attribute their work to the PSP? So we had 33 studies that were attributed to the PSP. 5 were unsure, and 5 reported no influence. So for these 33 studies, we asked researchers to tell us in their own words how exactly the PSP impacted their work. One participant said that PSP was instrumental in influencing the project, particularly with regards to shaping the research question and proposals, while others said they are using the PSP to justify the importance of their work to funders. And also we had several respondents who did say they're using the PSP for dissemination of their research funding. However, a small number of respondents simply said that they were not aware of the PSP. So this basically tells us there's still much work to be done in disseminating the PSP output to the wider research community. So this slide captures how often the researchers reference the PSP in either the grant applications, study protocols, or publication outputs. We also asked researchers to tell us whether they think the PSP will influence any of their future work, and we have had generally positive response. So basically, and showing us that ongoing influence of the PSP. So now let's turn to the publication. The research community submitted 119 papers. So here we can see the distribution of the publication count over the years. But I want, beside the volume, I also want to draw your attention to the quality. So for these 119 papers, we had a total of 5,829 citations, with a mean of nearly 49 citations per paper and a median of 8. So citation counts reflects how often other researchers reference a study in their own work, and it's basically an indicator of scientific influence. The H-index of this body of work is 36, and this is a measure that captures both research productivity and citation count. Journal impact factor was 944 with a median of 8. So this is an indicator of journal reach, visibility, and influence. So taken together, these show us that research on psoriasis is not only published, but it's also widely read and cited by the scientific community. So these 119 papers appear across 42 different journals, and most of the publication appear in highly influential journals such as British Journal of Dermatology, Journal of Investigative Dermatology, and we also had a couple in very prestigious journals such as Nature Communications and Nature Immunology. So, journal quartiles rank journals within each field in 4 groups based on the citation impact, with the quartile 1 representing the top 25% most influential journals. So here we can see that 85% of the psoriasis publications were published in quartile 1 journals. And this leads to higher visibility and make it more likely for the papers to be read by other scientists and to make it able to influence future research. So the final part of the study was to look at the impact of psoriasis PSP on the people who were involved in creating it. So we had 18 responses, and these were from healthcare professionals, patient carers, and partner organization representatives who were part of in either the study group, workshop group, or both. So for healthcare professionals, we asked whether the psoriasis PSP has had any impact on their clinical work. So the response was generally positive, and they reflected changes in how the clinicians think about their project, how they think about the unmet needs of the psoriasis patients, and made them aware of the importance of engaging the public and the patients in future research. So for the charities and partner organization, we had a mixed response, but for some organization, the psoriasis PSP has strengthened their credibility and helped shape their priorities and strategy. So in particular for Psoriasis Association, the psoriasis PSP has had a tremendous impact since they only consider applications that address at least one of the top 10 PSP priorities in order to be funded. Many patients and carers felt that they had made a meaningful contribution to shaping the research for a condition that affects their daily lives. Several also reported they feel more confident communicating with healthcare professionals. They are better able to discuss their condition. They gain valuable knowledge about the psoriasis and its management, and feel more empowered to contribute to future research discussions. So overall, the patient felt that their involvement in the PSP was valuable and that their voices had been heard. So we also asked participants about the impact of the PSP on their personal lives. And we had a relatively positive response of 56%. And many participants felt like empowered, heard, happy to be part of the PSP, or being named as an author on several publications. One participant was inspired to organize a psoriatic arthritis PSP that follows on this, while others highlighted the value of bringing together clinicians and patients together to develop a mutual understanding of the psoriasis priorities. So I would like to pause on this quote from a participant, which I think it captures the importance of this work and the engagement a PSP is meant to inspire. So as a psoriasis patient, I have always taken part in any research opportunities that have been offered and will always continue to do so in the future, as I believe that any and all research into this highly distressing disease is valuable and hopefully will offer better treatment outcomes for patients now and in the future. So finally, we asked participants to rate the psoriasis PSP process, its output, and the overall experience of involvement. So we had an average rating of 466, which I think is very encouraging and shows that James Lind Alliance produced a methodology that is credible and worthwhile for the people involved. So to bring this all together, since the publication of the PSP in November 2018, over £33 million have been awarded to projects that focus on psoriasis. We also found that psoriasis PSP was instrumental in shaping the research question and help researchers justify the importance of the work to funders. But however, there is still room of improvement, particularly in the dissemination process of the PSP output, as we did encounter researchers working in psoriasis who simply were not aware of them. So we need to make sure that the psoriasis PSP output reaches every researcher, key stakeholder, and funder. So finally, we found that participation in the psoriasis PSP had meaningful impacts on those involved. Participants valued the opportunity to understand patient and clinician views, also learning about the GLA method, feeling able to shape the research agenda, and improve the collaboration across stakeholders. So we can confidently say that the psoriasis PSP has not only influenced what research is being funded and conducted, but also the people involved in the process. Thank you very much for your attention.